Emily. I'm going to be doing a physical assessment on you today. I'm going to be looking at your skin during this physical assessment at your head and your chest, your abdomen, extremities, everything for your skin. Looking at the color, temperature, texture, moisture, scars, bruising, lesions, nevi, and edema. I'm going to start by looking at your head, looking at the size, shape, looking at the position, making sure it is symmetrical, and it is. I'm going to palpate your head and your scalp. Any tenderness?
No.
Checking for any masses, lesions, infestations, depressions. Also looking at the hair distribution, color, and texture. Everything looks good. I'm going to palpate your temporal arteries. Any tenderness?
No.
Okay. Palpate your TMJ. Any tenderness?
No.
Okay. If you'll open and close, chin side to side. Perfect. Checking for subluxation and crepitus, and there is none. I'm going to palpate the lymph nodes. Preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular, and they are all non-palpable. I'm going to do cranial nerve 5. If you will bite down, good. Checking the masseter muscle, and if you'll close your eyes and tell me where you can feel this touch on your face.
Nose, forehead, right cheek, chin, left cheek.
Perfect. And check cranial nerve 7. If you will smile, frown, puff out your cheeks, poke out your lips, and raise your eyebrows. Good. The face is symmetrical. Cranial nerve 7 and 5 are intact. I'm going to go ahead and look at the ears. Checking the position, the size, and the shape, making sure they are symmetrical, and they are. I'm going to palpate the pinna and the tragus. Any tenderness?
No.
No tenderness and no masses. I'm going to look in the auditory canal. Looking at the tympanic membrane, making sure that it is translucent and pearly gray, and it is. I'm going to check cranial nerve 8. If you will face the window for me, as much as you can, right there is good. If you will cover one ear and repeat after me.
1, 2, 3.
Okay, and other ear.
A, B, C.
Perfect. That was the whisper test. We're going to go ahead and do the Weber test, checking for lateralization. Tell me if you can hear this better in one ear or the other, or equally.
Equal.
Perfect. And then the Renee test. Tell me when you can no longer hear this.
No. No.
Okay, other side.
No. No.
Good. Air conduction is greater than bone conduction bilaterally. Cranial nerve 8 is intact. I'm going to go ahead and move on to the eyes, looking at the eyelashes, the eyebrows, and palpebral fissures. I'm going to look at the conjunctiva, which is white, and the sclera, which is pink and moist. There's no lesions or discharge. I'm going to move on to cranial nerve 2. If you will cover one eye and read the lowest line that you can.
D, H, J, B, S.
Okay, and the other eye.
D, H, J, B, S.
And then both eyes.
D, H, J, B, S.
Perfect. And that is checking gross visual acuity, and that was central vision. We're going to move on to peripheral vision for cranial nerve 2. If you'll face me, and tell me when you can see my finger.
No.
Yeah, look at my nose.
Yeah. No.
Perfect. And we're going to do cranial nerve 3. And we're going to check the direct and consensual pupillary response to light. If you'll look at my nose. Perfect. And they do react to light. And we're going to do a combination and convergence. So you look at my light. Look at the wall. Look back at my light. Good. Cranial nerve 3 is intact. And we're going to go ahead and do cranial nerves 3, 4, and 6, checking the conjugate gaze with the extraocular motions. Follow my light with just your eyes. Perfect. Cranial nerves 3, 4, and 6 are intact as well. I'm going to check the internal eye structures. I'm looking for a red reflex. Okay. Good. The internal eye structures look good, and the red reflex is present bilaterally. I'm going to move on to the nose, making sure that it is midline and straight, and it is. Checking patency. You'll breathe in and out. Other side. Perfect. And we're going to palpate the frontal and maxillary sinuses. Any tenderness?
No.
Perfect. I'm going to move on to the mouth. You will open up. And stick out your tongue. And raise it up. Good. We're checking the lips, tongue, teeth, gums, palate, posterior pharynx, tonsils, buccal mucosa, salivary ducts, and the floor of the mouth, and everything's pink and moist, looks good. We're going to check cranial nerves 9 and 10. If you'll open and say ah. Good. The soft palate and the uvula raise symmetrically with phonation. And then cranial nerve 12, if you'll stick out your tongue. Move it side to side. Good. The tongue is midline with no fasciculations. We're going to move on to the neck. I'm going to palpate the trachea, which is midline. This way. And the thyroid gland, if you will swallow for me. Good. And swallow again. Perfect. They are both midline. I'm going to palpate the carotid artery, if you will turn this direction. Good. Another way. Good. The artery pulses are 2+. Oh. And I'm going to check the bruits with the bell. There are no bruits. We're going to do range of motion, so if you will flex, extend, hyperextend, laterally flex, and rotation. Good deal. And then we're going to check cranial nerve 11, if you'll shrug. Perfect. No, that is all intact. We're going to move on to the posterior chest. So if you'll face this wall over here. We're looking for any signs of respiratory distress, including use of accessory muscles, tripod positioning, nasal flaring, tachypnea, cyanosis, or retractions. There are none. There's also no obvious deformities, and everything is symmetrical. I'm going to palpate the chest wall expansion. If you'll take a deep breath. Good. And tactile firmitis, say 99.
99, 99, 99.
Perfect. I'm going to go ahead and percuss in the intercostal spaces. Good. Resonance is heard throughout. I'm going to go ahead and auscultate, starting above the scapula. And take deep breaths for me. Good. Lung sounds are clear bilaterally. I'm going to go ahead and check egophony. If you'll say E-E-E.
E-E-E. E-E-E. E-E-E. E-E-E. E-E-E. E-E-E.
Perfect. And check bronchophony. If you'll say 99.
99, 99, 99, 99, 99, 99.
Good. And last, whisper pectriloquy. If you'll whisper 1, 2, 3. Perfect. Everything is symmetric. All right, we're going to do the anterior chest. If you will turn and face this direction for me. All the way if you can. We're going to be looking for any obvious deformities, and everything looks symmetrical. I'm going to go ahead and palpate chest wall expansion. If you'll take a deep breath. Good. And tactile firmitis, say 99.
99, 99, 99.
Perfect. It is symmetrical. And I'm going to go ahead and auscultate. Take deep breaths for me. Good. Everything, lung sounds are clear bilaterally. I'm gonna move on to the heart. I'm gonna first listen with the bell. Listen to the aortic valve, second intercostal space, right sternal border. Pulmonic valve, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid valve, fourth intercostal space, left sternal border. And the mitral valve, fifth intercostal space, mid-clavicular line. And do it with the bell, aortic valve, pulmonic valve, Erb's point, tricuspid valve, the mitral valve. I'm going to feel for the point a maximal impulse, which is the fifth intercostal space, mid-clavicular line. I'm going to listen to the apical pulse for a full minute. Now we'll note the rate and the rhythm. Okay, if I can go ahead and have you lie down. I'm going to check for jugular vein distension and pulsations at a 30 to 45 degree angle. And I'm going to look for any heaves or lifts. There are none. I'm going to feel for a thrill in each of the auscultation points. Aortic valve, pulmonic valve, Erb's point, tricuspid valve, the mitral valve. And I'm going to go ahead and redo my auscultation while lying down. The aortic valve, pulmonic valve, Erb's point, tricuspid valve, the mitral valve. And again with the bell. Aortic valve, pulmonic valve, Erb's point, tricuspid valve, and the mitral valve. There are no murmurs and no extra sounds. All right, I'm going to move on to the abdomen. When I'm doing this in clinic, I will be doing everything underneath the shirt. Before this presentation, we'll be doing everything over the shirt. I'm going to look at the contour. It is flat and everything looks symmetrical. I'm going to go ahead and auscultate for bruits. The aorta, the renal arteries, the iliac arteries, and the femoral arteries. I'm going to auscultate the vowel sounds starting in the right lower quadrant. Vowel sounds are neuroactive. I'm going to go ahead and percuss. Listening for tympany, dullness, and flatness. And tympany is heard throughout. I'm going to go ahead and palpate. Is there any tenderness?
No.
No tenderness and no masses. If you will hold your breath, I'm going to go ahead and palpate the liver and the spleen. Liver is palpable and the spleen is not. All right, if you'll go ahead and sit up facing this wall for me, we're going to check CVA tenderness. Any tenderness?
No.
Perfect. All right, you can turn back around. We're going to go ahead and move on to the upper and lower extremities. During upper and lower extremities, I'm going to be looking at the skin for overall warmth, color, skin integrity, and edema. I'm going to start by doing the cerebellar coordination. So if you will put your hands on your knees and hand flip-flop them over quickly. Perfect. If you'll put your finger on your nose and come to mind quickly. Okay. If we'll do serial finger opposition, serial finger opposition. So put your thumbs to your fingers quickly, both of them. Perfect. Cerebellar coordination is intact. I'm going to go ahead and do light touch, so if you'll close your eyes and tell me where this is on your upper extremities.
Right arm, left arm, left hand, right arm.
Perfect. I'm going to go ahead and do the lower extremities as well. Close your eyes.
Right leg, left leg, right foot, right knee, left foot.
Perfect. Okay, I'm going to go ahead and do vibration sensation. If you'll put your hands out, I'm going to do this over the proximal over your wrist. You feel that?
Yes.
Okay, other side.
Yes.
Perfect. I'm going to do the medial malleolus. Feel that?
Yes. Yes.
Okay. I'll go ahead and check the radial arteries. They are 2+ bilaterally and cap refill. Less than 3 seconds. I'm going to check the dorsalis pedis pulses. 2+ bilaterally and the posterior tibial pulses. 2+ bilaterally and cap refill. Less than 3 seconds. I'm going to go ahead and check the deep tendon reflexes. This is brachioradialis, bicep, and tricep. Okay, other side. Brachioradialis, bicep, tricep. Okay, and patellar, Achilles, and Babinski. Other side, patellar, Achilles, and Babinski. Good. Babinski's negative and all other reflexes are 2+. I'm going to go ahead and do stereognosis and graphesthesia. So if you'll close your eyes and tell me, open your hands, tell me what this is.
Coin.
Yes. And what this is?
Pin.
Perfect. Stereognosis is intact. And graphesthesia, keep your eyes closed and tell me what shape this is.
Circle.
Yes.
Square.
Perfect. Stereognosis and graphesthesia are both intact. Okay, we're going to move on to the joints. So I'm going to look at the fingers, the wrists, the elbows, and the shoulders for any redness, swelling, symmetry, deformities, crepitus, nodules, and tenderness. And everything looks good. I'm going to go ahead and do your fingers. So if you will flex, extend, hyperextend, adduct, abduct, and thumb opposition. Good. If you'll grasp my hands. Good. Strength is 5 out of 5. We're going to do your wrists. If you'll flex, extend, hyperextend, ulnar deviation, radial deviation, and rotation. Good. And elbows, flex, extend, hyperextend. Good. We're going to do your bicep strength. If you'll pull towards you. Good. Tricep, push towards me. Perfect. 5 out of 5 for both. We're going to check the abduction and adduction strength for the shoulders. If you'll hold your arms out and push up against me. Good. Push down against me. Perfect. 5 out of 5 as well. We're going to go ahead and flex up. Extend. Hyperextend. Good. Internal rotation. External rotation. And abduct out. Adduct together. And circumduct. Perfect. Range of motion for the shoulders are intact. We're going to move on to the lower extremities. I'm going to be looking at the toes, the ankles, and the knees for any redness, swelling, symmetry, tenderness, nodules, crepitus, and deformities, and there are none. I'm going to do your toes, so if you will flex, extend, hyperextend, abduct out, adduct together. Good. And we're going to do your ankles, so if you will dorsiflex up, planar flex down, inversion, eversion, and rotation. Good. We're going to check the strength of your ankle, so if you will dorsiflex up, good, and planar flex down. Good. Strength is 5 out of 5 for those. And the strength of the knees, so if you will push out, good, pull in, perfect. Strength of the knees is 5 out of 5 as well. Okay, if you will go ahead and stand up. I'm going to have you stand over here. I'm going to check the hips, checking the hip joints for any redness, swelling, symmetry, tenderness, deformities, crepitus, or nodules, and there are none. We're going to do the range of motion of your knees. So if you will flex, extend, hyperextend, good, other side, flex, extend, hyperextend, good. We're going to do your hips, so if you will flex up, extend, hyperextend back, good, internally rotate, externally rotate, abduct out, adduct across, good, and circumduct in a circle, good, other side. We're going to flex up, extend, hyperextend to the back, internally rotate, externally rotate, abduct out, adduct across, and circumduct in a circle. Good deal. Okay, so I want you to turn around. We're going to look at your spine. We're looking at the curvatures, alignments. Is there any tenderness?
No.
No tenderness? Okay, I'm going to have you flex forward. We're going to look for any scoliosis. Everything looks straight and good. Good, we're going to do range of motion, so that is flexion. Extend, hyperextend back. Good, lateral flex to the sides. And rotation. Perfect. And then we're going to go ahead and have you do the Romberg test. So you'll stand straight like this. Good. Close your eyes. No swaying. Good. I'm going to have you check your gait. So if you'll walk to the window. Good. And when you come back, do toe to heel, checking your tandem gait. Very good. And I want you to hop on one foot and hop on your other foot. Perfect. And that concludes our physical assessment.